Hello, everybody. Happy Thursday. Here we are again. Um, Hello to everybody that is watching on Instagram. Hello to everybody that is watching in the Clinical Connections Facebook group. I'm so happy to be here today to be talking to you about today's topic. It is a very good one. It's a very popular topic. Today, I will be sharing with you the 3 things that you need to start a business. There are a lot of people out there that want to help you start a business, and all of them say something different, right? Some say that you need business degrees and you need experience with leadership. Some say that you need to have all of your ducks in a row before you can start anything. Some say you need to have a lot of money in order to make more money. There are also a lot of beliefs out there among clinicians and new grads and even students about starting a business. Things like, I need to have a specialty certification or people are not going to want me to help them. Or beliefs that I need to have, 1,000 years of experience working with patients in order before I can even start my own business. And then beliefs that, I need to know as many treatment techniques as I can so that I can just be able to help anybody that walks in the door of my business. But I'm here to tell you that absolutely none of that is true. So today, I will be busting some of those myths and really just teaching you the most important things that you need in order to start, regardless of the type of business that you want to start. Okay, so for anybody new here, I will introduce myself. I am Dr. Jody Miller. I am a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that you can think of for PTs. I've done a lot of outpatient. I've done acute care, oncology. I've done home health. I've done pediatrics. I've done travel therapy. Most of my experience has been in skilled nursing facilities. I've been in a lot of different ones. I've also been a rehab director of skilled nursing facilities. But now I have my own cash-based practice here in the Tampa area, and I'm also the owner of Clinical Connections Mentoring, which is where you are today. So again, thank you for being here. Welcome, love to have you. What I'd like to do, if you are watching live, please go ahead, drop live in the comments, whether you're watching in the Facebook group or you're watching on Instagram. Just drop live, tell me where you're watching from. If you are watching the replay, same thing. Just type replay and tell me where you are watching from. I just like to know who I'm talking to so I can connect with you a little bit better. Also, what I want to know in the comments while you're typing away, tell me, is it a goal of yours to start a business? And what is the biggest thing that's holding you back from starting? So I'll give you a second to drop that in the chat. Guys, so what I want to do now is also start with a little bit of a poll. Okay, so I want you to either drop a thumbs up or wave if you're watching on Instagram, or even physically wave. Let me know if you work for a boss who just doesn't support you. Maybe your PTO is constantly denied. You feel like you can never talk to them. Their door's always closed. You can never find them. Maybe you just don't feel comfortable talking to them or even sharing your ideas with them. They just are generally unapproachable. So go ahead, if that is you or the type of boss that your boss that you currently work for, if that describes them, go ahead, give me a wave or say me, whatever in the comments. Okay, now same thing. If you are tired of just being told what to do at work, right? Tired of having to be told that you have to bill a certain number of units with every patient. You're tired of being told that you have to bill E-stim with every patient that you see on your schedule. You're tired of being told or voluntold to do certain things for work, like going to work the health fair on Saturdays, or you're just tired of being told that there isn't enough time to talk with family members or do family training. That was me. I definitely was told that by my boss. So let me know if that's you. You're just kind of tired of being told what to do. Give me a wave, drop it in the comments. All right, now tell me, are you so busy at work that you're just exhausted by the time you get home? You have to see 3 to 4 patients every hour. Documentation is so bad. You have so much of it. You barely have any time to eat lunch, let alone go to the bathroom. Constantly on the go from the minute you walk in the door at work. organizing your schedule, talking to coworkers, communicating with other providers, running from one patient to the next. Is that you? You're just so exhausted by the time you get home from work. Let me know. All right, now let me know if you just can't stand your work schedule. You hate that you have to wake up at 5 a.m. just to get to work on time. You're annoyed that you have to work weekends, 2 weekends a month, maybe. You're frustrated that you have to work most of the holidays. That's what happens when we're in healthcare. You're over your 1 hour commute to work, not to mention the traffic you got to sit in to get to work. You can't stand having to work till 8 o'clock on Thursdays, which means that you have to miss happy hour with all your friends. Let me know if that's you. Drop it in the comments, give me a wave. And then let me know if you are burned out. Is that you? It's a struggle to wake up every morning and go to work. You're bored working with your patients. You've lost all joy in what you do at work. You struggle to connect with your patients. You feel like you're just kind of going through the motions. Let me know if that's you. I've been there, experienced all of these things that I just described. So let me know if any of that resonates with you. Even if you didn't feel comfortable dropping a me or waving, it's fine. It's okay. But for those of you that did, if anything that I just said resonated with you, I want to know, let me know who's ready to make a change for any of those things. Drop me, wave, whatever. Who's ready to be your own boss? Who's ready to have the freedom to make your own decisions about how you get to treat your patients? Who's ready to have that ability to create your own schedule that doesn't include weekends, or maybe it just starts at 10 a.m., gives you every Friday off? Who's ready to be able to decide the type of patients that you get to work with? Who is ready to create your dream job? Let me know. Give me a wave, drop me, whatever. So I get a lot of messages from new grads, similar to you if you're a new grad watching, who just want to start their own business. They share similar frustrations with their current job, even as new grads. They want more freedom. They want to make decisions. They just want to be happier and they don't want to burn out. They're also really scared. They're scared to make that leap. They're scared to get started. They're scared to leave the security of a salary, right? Knowing you're going to get paid every 2 weeks. They're scared that it's going to be too much. It's going to be too hard. They're scared it's just not going to work. Answer that I always give, same answer every time, is, but what if it does work? What if it's wildly successful and you start to love your job again? What if you actually create something amazing? And what if it's really fun? You thought about that? So I get it. Excuse me. I get it, right? Leaving a job that gives you a set paycheck every week, that's secure. So it's scary to think about what happens if that revenue slows down. I've been there. That's what your brain is doing. It's doing its job. It's supposed to protect you from those scary and those unknown things. So it creates these stories that kind of keep you from taking that leap. And when you start to believe those stories, you tend to stay stagnant. You get stuck. You get stuck in that routine of seeing 3 patients every hour, taking your documentation home with you, working 50 hours a week, being afraid to talk to your boss. So the question is, do you really want that? Do you want to stay in that? Or do you want to change? And I don't think anybody watching this really wants to stay in that type of situation. Otherwise, you wouldn't be watching this live stream right now, right? So I'm here to help you take that first step. I'm going to tell you the 3 things that you need to start a business, whatever that business is. Maybe it is a PT clinic. Maybe it's a non-clinical gig. Maybe it's just selling artwork. Whatever it is, I'm just going to tell you those 3 things, because in reality, not everybody wants to own a PT clinic or run a cash-based clinic or even a hybrid clinic. So I'm just going to tell you the 3 things that you need to start any type of business, okay? So let's start with number 1. First, you have to figure out what your business is and start simple. If you're watching this, you may already know what that business is going to be. Awesome. Kudos to you. But if you haven't really thought about that yet, that's where you got to start. So think about, who do you want to serve? What do you want to do? Like, what do you actually want to do for your business or your job? What do you want that business to be? From here, then you need to determine the status of your business entity, okay? I will give you a few examples. I'm only going to give you a few because there are quite a few, but some examples, which are most common for people starting, is either a sole proprietorship, an LLC, or a PLLC. Okay, so the sole proprietorship is an unincorporated business with only one owner who pays personal income tax on any profits that they earn. Okay, so sole proprietorship is actually the easiest type of business to establish because there's no government involvement here. Okay, so I will say that most businesses that become LLCs or corporations, they always start as that sole proprietorship. It's just one person and they just kind of start earning money. But because there is no government protection, all the liabilities of that business then extend to the owner. Okay, so that's a sole proprietorship, easiest one to start with. An LLC is a limited liability company. This is a business structure that protects its owners from personal responsibility for the business's debts or liabilities. Okay, so LLCs, they do not pay taxes on their profits directly. Their profits and their losses are kind of passed through down to the members of the LLC, who then report them on their individual taxes. Okay, LLCs do provide more flexibility and more protection for the owner compared to that sole proprietorship. Okay, and then the third one I do want to talk about today is the PLLC, which is the professional limited liability company. This is similar to an LLC. It's designed like it, but it's specifically for licensed professionals like lawyers, accountants, doctors, dentists. The difference between the PLLC and the LLC is that the PLLC will not protect you from claims of malpractice or wrongdoing. Okay, however, there is a benefit in that of the PLLC, and that is that the wrongdoing of one individual member does not create liability for all of the other members of the PLLC. So those are just some differences. It is important to understand that certain states have different requirements. So some states may not allow the sole proprietorship, and they may require you to get an LLC or whatever. So I always tell people here are the differences, but I would still talk with an accountant. They can help kind of guide you here on determining which type of business entity is best for your business and your specific situation, specifically in the state that you live in. Okay, so step number 2 for starting a business is determine your business name, right? And I would recommend making it a name that's very easy to remember, but also a name that stands out. My PT clinic, my PT business is called Modus Vita Physical Therapy. I didn't want to use Miller Physical Therapy. Certainly doesn't stand out. And think about how many Millers you know, right? So I knew I didn't want that. It didn't stand out to me. I wanted something that stood out, people could remember, but also had some meaning to it. So Modus Vita is Greek for movement is life, right? And that's how I think that regardless of what type of PT you're doing, the focus is always on moving, right? I just want people to move, whether it's a condition, an injury, an impairment. We want people to move again. So that's kind of how I came up with my PT clinic's name. But I also want to challenge you here, don't get hung up here, okay? This is a really easy place to get stuck and kind of hold you back from taking that step, right? Your brain's going to start telling you, oh, you don't have a good name. We got to sit here and really come up with a good name before we can do anything else in our business, right? Again, that's your brain protecting you from wanting to move forward into scary things. So don't let that happen. Do not get hung up here on what the name of your business is going to be, okay? I've seen people spend like weeks just trying to come up with a really good business name when they could have spent all that time actually getting clients and starting to earn money, okay? It's just a name, just pick it, okay? All right, step number 3 is to obtain your business license. So this is for any business entity that I talked about above, except for that sole proprietorship, because you don't have to do that for the sole proprietorship. Remember, there's no government involvement there. So if you've decided on an LLC or a PLLC, or maybe even a S Corp, there's other levels. If you've decided that that's what your business entity needs to be, you talk to your accountant, that's what you guys agreed on, then you have to get the business license. So once you've kind of done all that, you need to register your business with the state that you are going to work in or live in, right? Once you've done that, once you register, it's actually very easy. In the state of Florida, it's simply just a website. You go in, put all the information in pretty quickly. You get an EIN number, which is your employer identification number, which kind of acts like the social security number for your business. Excuse me. So this EIN number is used to identify you, your business records, your tax returns, any documents with the IRS. I'm getting over a little sinus infection. So this is super simple, and it does happen, does happen very, very quickly, okay? So once you've decided your business entity, you've chosen your business's name, you've registered your business, and you've gotten your business license, you've got a business. Congratulations, right? 3 super simple steps just to start your own business. Okay. Once you've got these, notice, right? Once you've got these 3 things done, now you can start seeing clients and earning revenue or earning some income. Notice that none of the 3 steps included things like completing a residency, getting an MBA, getting a bunch of certifications, working in a clinic for 5 years, setting up a documentation system, creating a perfect website, designing business cards. None of that is needed to start a business. These things can happen kind of along the way and as you grow. Also, kind of a side note, absolutely none of those things that I just mentioned will bring you clients either, right? It's just something that you can kind of add later on, but those things don't necessarily mean you're going to get more clients, okay? This brings me to my next bonus step for you, which is to find a mentor or someone to support and guide you through this whole process. Once you've decided to kind of take that leap, you've gotten the business set up, that is when it's a good idea to start to get some support and some guidance to take those next steps within your business. A mentor will help you figure out the next best steps for you in your business, because this is literally different for every single person who owns a business. Okay. That's where I can help. That's what I do. I can help you figure out how to design your business so that it works best for you, the best logistics for your business, whether it's virtual, in person, mobile, right? The best systems for your business. So things like how to accept payment, how to set up your documentation system, which one to use, how to do scheduling, how to communicate with people, right? I can help you with how to design, manage your budget, creating policies and procedures that protect your business, determine pricing, how to build your business so that it supports the freedom and the joy that you have been craving and that you're not experiencing right now in your current job. And so much more, right? These types of things are best done with the help and the support of somebody else. Without that guidance, it's going to take you much longer to try to figure it all out. Take this from someone who learned the hard way, okay? It can be done by yourself, but I guarantee it's going to take 2-3 times as long to get where you want to be if you try to do it by yourself, okay? This is just one of the areas that I like to guide clinicians on in my complete clinician mentoring program. And this absolutely does include new grads, whether you're a student who wants to now start creating a business, or you're a new grad who knows that you want to be your own boss. Or maybe you're a seasoned clinician who burned out from traditional patient care, and you're looking to take control of your career again. This is what I like to do. Let me support and guide you as you create the career that you actually want for yourself, okay? But my complete clinician program doesn't really just stop there. I also give guidance, support, and mentorship around how to effectively communicate with other people, like patients, employees, family members. Teach you how to be an effective leader. Teach you how to develop badass treatment sessions by knowing which interventions are best for each patient. So there's also clinical mentoring in my program. Teach you how to gain confidence in your skills, as whether it's a boss, a clinician, a business owner. Teach you how to set up your career so that it's free of burnout, so you can enjoy your job and still have time to have fun on the nights and weekends, right? That's what you want. Nobody wants you went in school for 3-4 years straight, spend all your free time studying. Who wants to go work 50, 60 hours a week? No, you want to have fun on nights and weekends? I can help you figure that out. So send me a DM, type complete in the comments below. Whether you're watching on Instagram or Facebook, go ahead, drop complete if you're interested in learning more about my program. Love to help you figure out how to enjoy your career again. And that's super important to me because too many people are burning out, right? And for you, maybe that answer is to create your own business, whatever that business might be. Okay. I hope you learned something new today. Please go ahead, drop in the comments any aha moments or something that really kind of stood out for you, something new that you learned in the last 20 minutes. I want to thank you for watching, whether you're watching in Instagram or you're watching in the Facebook group. If you have any questions about what I talked about today, if you don't want to drop them here, feel free to send me a message. Or if you want, just go ahead, drop them in the comments for everybody else to learn from. I will definitely come back and answer any questions that are left, okay? Again, thank you for coming, and I will see you next time. Bye.